Welcome to the Acupuncture Outsider podcast. My name is Richard Hazel, and in the time it takes for you to commute to or from work, I hope to have shared something of interest about orthopedic acupuncture using motor points, trigger points, myofascial slings, neurofunctional acupuncture, segmental treatments, anything that crosses my mind that seems to be of interest. I hope you'll enjoy it. Hello, and welcome to another episode of the Acupuncture Outsider. This is Richard Hazel, and today I wanted to talk a little bit about why I rely so heavily on the work of Vladimir Janda from the Prague School of Rehabilitation in Prague. Karl Levitt was hugely important as well, and his colleague. But I wanted to talk about Janda specifically because I really feel like working with his methodology has been hugely successful for me with patients. So I wanted to talk about what makes Dr. Janda's methodology unique and really groundbreaking when you're talking about treating pain, acute or chronic pain. Dr. Janda said that there are two schools of thought when it comes to treating pain in an orthopedic approach. There is a functional and there is a structural approach. The structural approach is what most people, most doctors, most medical professionals are using. So you know the structural approach, but I'll talk about it. You have knee pain. Something is wrong with your knee joint. You have inflammation. You have a runner's knee. You have, there are all sorts of ways to have knee pain. The current methodology, get some images, make sure nothing's torn, make sure nothing needs surgery. Maybe there's a meniscal tear in the knee, but the doctor says it's not requiring a surgery. You need rest and physical therapy. And we're going to inject some cortisone. So you have a very targeted approach that says that your pain is coming from the inflammation. So, in fact, let's even skip over the meniscal tear scenario and just make it something where there's really nothing to be done, okay? You are a runner and you have knee pain, and there's nothing wrong with your knee. Let's say they did an MRI and they just said, you have inflammation. Here's what we found. Here's your prescription for 8 weeks of physical therapy. And say you did the physical therapy and you still have knee pain. And you're a runner, so you really, really, really want to get back to running. If you know runners, you understand what I'm saying. So what do? The structural approach says anti-inflammatories. So we're going to treat the joint. Maybe we're going to do some red light therapy. Maybe we're going to do shockwave. Maybe we're going to do some kinesiotaping. Maybe we're going to do some voodoo flossing. Maybe we're going to have you do some isometrics, negative reps, more important. Just there are many, many ways to rehab a knee pain, and it's all focused on the knee. Here's the thing. Dr. Janda recognized that the body works functionally as a whole, and that most issues begin at the pelvis. The muscle tone that gets increased and the muscle shortening that can happen are due to responses from the autonomic nervous system and from proprioception and spinal reflexes. They're the whole nervous system that works to control movement. Just your basic movement patterns are going to be driven by your central nervous system. There's a programming that you are not aware of. It is a completely subconscious movement pattern. And as you have developed, you may have basically learned bad movement patterns. Um, those movement patterns can eventually lead to pain, because when you have to overuse a muscle that is not meant to be doing the amount of work that it's doing, the muscle will begin to shorten to a pathological uh, level that will increase pressure on the joint that muscle crosses. And that pressure and imbalance will eventually lead to pain, inflammation, tendinitis, osteoarthritis, possible meniscus tears. There are many diagnoses that one will arrive to due to the muscle imbalances created by poor core stabilization, feed forward mechanisms that do not engage in time to prevent injury. When you have an unstable core, your body will use other muscles to stabilize, like the psoas. Psoas is helpful for core stabilization. You want to create intra-abdominal pressure. But if your abs are weak or fatigued, you may use other muscles like the quadratus lumborum and the psoas to help stabilize the spine. So maybe your psoas is overused because you have poor core stabilization, and being that the psoas helps hip flexion, maybe now as a runner with a weak psoas, you have to overuse your rectus femoris and maybe your sartorius and maybe your TFL, which are all hip flexors that do other things as well. So so you have a pattern that you've developed that is very quad dominant, that's doing the work more with your quad than with your glutes. And so that overuse will catch up to you. And eventually you'll have muscle shortening that starts to put pressure on the knee. Maybe your TFL is affecting your IT band, and now you have patellar tracking issues because the IT band that crosses over the lateral part of the patella is tight and creating tracking issues that will create knee pain. And so you have a psoas that's weak, and your rectus femoris is now tight on that side, and it pulls on the tendon that crosses the patella, the patellar tendon that's part of the quads and the rec fem. So now you have pulling on the knee, that when your knee is bent, you have knee pain because you are stretching a super tight quadricep muscle that's putting more pressure on the knee. So you have to kick your leg out to avoid knee pain. Maybe your sartorius, which also helps hip flexion, is tight and it's attached at the pes anserine. And maybe also your gracilis is tight because you're not having good lateral stabilization. So now you have medial knee pain caused by those muscles at the pes anserine. So the muscles are affecting the joint, but treating the joint is so basic that it completely misses the point. It provides a temporary patch that does not in any way address the movement pattern that you've adopted or the overused muscles that are now too short. So you're basically walking around, maybe you have less knee pain because they gave you an injection, but you're walking around with the same unstable hip, the same shortened muscles from the hip flexors that are affecting the knee. And by the way, all that tight, short hip flexors are going to inhibit your glutes, which may eventually lead you to back pain. So you have a functional issue that's being driven by the nervous system, by your basically by your autonomic nervous system, the input it's getting, pain that will cause a contraction of the muscles that want to protect the joint that's in pain. So, there's a whole systemic approach. There's a functional approach that we can use to get you out of pain in the right way, that will leave you out of pain, that will allow you to go back to the sport that you love, like running, and only need occasional maintenance to address muscle shortening that is going to happen from using your muscles. And once we corrected the muscle shortening, say we correct the tight psoas, maybe we get your core muscles, your abs firing better. We're making sure that you don't have any excess anterior pelvic tilt that maybe led to the knee pain. So now you're in a good position to do some physiotherapy, some physical therapy, rehab with an expert who can help you relearn the way to move, because your programming is not working for you, and it's all done at a subconscious level. So you're probably going, in the Janda approach, you correct the issues in the muscles, you correct the muscle imbalances, and then you come back to core stabilization and you learn how to core stabilize correctly, so that in this instance, this example, you're getting good intra-abdominal pressure to stabilize the spine that will not overuse the psoas and the QL, that will not overuse the other hip muscles for lateral stabilization, because you'll have good intra-abdominal pressure. Once you've learned that good core stabilization, someone who is an expert can help you to challenge your core stability, maybe using weight on one side or standing on one leg. It really takes that much work to retrain those patterns in your brain. It can take over 6 weeks of focused, conscious attention to rewrite a subconscious movement pattern. So that's the Janda approach, and it works. And it works extremely well. And it works extremely quickly when you're talking about resolving pain. Not everybody has an injury due to those movement patterns. It could just be a sports injury. And maybe you just are overusing a certain group of muscles. Like, I work on several college baseball pitchers, and they all come in with the same injuries. And it's a lot of overuse of the forearm and the flexors, the finger flexors, and a tightness in the latissimus dorsi, the pec major, serratus anterior. There's a lot of shortening of the bicep and tricep, the forearm flexors, the extensors of the wrist, all get very, very tight from repetitive movement. Now, of course, we check their core strength. Very often their core is very strong, and this is just an overuse injury. And of course, as a baseball pitcher, they're always working on perfecting their form. So they're always working with coaches and video and learning how to throw in a way that does not overuse the forearm. They tell me you should ideally not feel the forearm getting involved. So because the power has to come from the core and the hips, and it shouldn't be upper extremity being overused. But of course, people fatigue. And when you fatigue, that's when you're at risk of injury. So when I work on athletes like that, I, of course, am considering the core, but I know that getting them back to throwing with no pain and also improving their performance is going to be focused more on the upper body and the hips, the core strength. Yes, hips, if that's necessary. They usually have one side that internally rotates better and one side that externally rotates better. Things like that it's all about power for their throws. But I could get them out of elbow pain in like one session. Keeping them out is all the stuff I just mentioned. But you can get somebody out of pain very, very quickly with a functional approach that does not require knowing what the MRI said. As long as you know that they've been cleared, they don't need surgery. There's no ligamentous injuries. They're just in pain. The person's just in pain. It's just a muscular thing. When they come in because they've been told conservative approach is what's necessary for you to get better, that's where we can do enormous things very quickly for our patients who have pain, shoulder pain, elbow pain, wrist pain, foot pain, knee pain, whatever it is. We can take a functional approach and get them out of pain. I tell people now, and I didn't used to. I used to just say, I have to wait and see how you do. But I tell people now, you're going to feel significant improvement on your first visit. And based on what you tell me after the first visit, I can give you a better estimate of how many visits I need to get you better. But my results on the first visit are so consistent that I feel very confident telling most people that they're going to feel improvement after their first visit, and usually in the room. The only people that I'm not doing that with are extremely older with multiple issues. But the average person that I see, I don't guarantee anything. I'm not giving money back. I work damn hard to provide those good results. I'm not giving money back. If you didn't feel better on the first visit, we're going to discuss, and I'm probably sending you to the ER for some imaging because you really should get better. But the results are very fast when you take a functional approach. So when you see, people there are a lot of people now teaching orthopedic acupuncture, sports acupuncture, or whatever you want to call it. They seem to want to get people hung up on the multiple medical diagnoses and learning how to figure out which one of them it is of the medical diagnoses. And I would just say, number one, I should not, as an acupuncturist, I should not be your first line of assessment when you have a lot of pain. You really should talk to your general practitioner and find out if you need an X-ray or an MRI, if you're in that much excruciating pain. You really should, and you're going to help us both because we can at least clear what it isn't. We can figure out that there's nothing to worry about. So that's number one. I don't really like the idea of acupuncturists trying to be the first line of diagnosis. We have medical doctors that have a lot more at their disposal for testing, and they have the background necessary to rule out any red flags. So I want someone to see a GP if they're in a lot of pain. And if they come to me and then they tell me how much pain they're in, they can barely stand, I'm going to treat them to get them out of pain because I know there's no damage that's going to be done by me treating. But I'm going to instill upon them that if they don't feel significantly better, that they need to go to a medical doctor or talk to their doctor on the phone or see if you can get in at an urgent care facility or an emergency room, because you really should not ignore excruciating pain. Now, that said, I get the people who had excruciating pain. They saw their doctor. Maybe the doctor gave them a course of prednisone, and they've had some diagnosis, some diagnostic images, and the doctor feels like a conservative approach is going to be sufficient. Those are my patients. That's whom I want to see. They've ruled out anything frightening. We know there's not a tumor on your spine. Now you're my patient. Now I'm going to use what I've learned from Dr. Yanda to assess and treat. And I really don't need to know whether the doctor thinks your elbow has tendonitis, tendinopathy, or bursitis, like a olecranon bursitis. I really don't. I don't. I mean, it's nice for the conversation. It's great. Like, I'll talk about the weather too, but the diagnosis doesn't change my approach, and that's what I'm getting at, because I am taking a functional approach to the problem. I am not taking a structural approach to the problem. Your diagnosis is not going to make me want to put needles into your joint to tap on whatever injured tendon or injured bursa or injured ligament or anything like that. I will not be changing the treatment according to what the doctor said. I don't put needles into knee joints. I don't put needles into elbow joints. I don't change the treatment because I have 100% confidence that what Dr. Yanda did will work for my pain patients. I need to understand what are the underlying instabilities and muscle imbalances that are causing the problem. Why do you have tendonitis, tendinopathy, bursitis, arthritis? Those are symptoms of a movement dysfunction. Those are a symptom of lost core stabilization, lost proprioception, muscles not firing at the right time, learned movement patterns that are not helpful to you. You are compensating. If you have a compensation pattern, that could be from repetitive stress, or it could be because you are an athlete or because you used to be an athlete. You now have compensation that has led to this day where I am working on your pain. And my goal and my job is to correct the imbalances that are leading to your pain. So I'm freeing the joint. I'm getting better joint mobility. I'm increasing your joint range of motion. I'm improving joint centration. I'm affecting patellar tracking in a positive way. I'm increasing the core stabilization that you need to not have to use your compensation pattern that led you to the day that you're coming for acupuncture. So if we apply Vladimir Yanda's approach, we can not only give people very quick, very, very good results, but we can give them a lasting result because we're improving the core stabilization that was lacking, that led to the dysfunctional movement that led to the pain. So it's a functional approach to treating pain. Some of that, I need to say there are segmental issues on chronic pain patients. Those segments are sensitized, and that leads to a motor sensory response. Pain can inhibit muscles. Pain can make multifidus muscles that stabilize the spinal vertebrae weak or inhibited. Pain can make muscles hypertonic, which can cause pain. Sensitization at the spine needs to be taken into account. And in that case, I am treating locally at the segment, but thinking functionally still that the segment is affecting the downstream muscles that are causing dysfunctional movement and pain. So I'm addressing spinal segmental sensitization with an overall approach of improving core stabilization, mobility, joint range of motion, and proprioception and good movement pattern, etc. So that would be the exception, because if you're going to say that the spinal segment is the problem, then yes, I'm treating locally, but I'm not treating it locally and then just calling it a day. The spinal segment's only part of the story. This is why, if you're an orthopedic acupuncturist who treats a lot of pain, you get a lot of patients who already had surgeries, laminectomies, they had discectomies, etc., and they still have a lot of the symptoms. Once there's no more segmental issue, there's no more nerve encroachment, they still have the same symptoms because the body's response to pain left muscles inhibited and hypertonic, short. So the dysfunction's still there. And that's where we can come in, because we're basically cleaning up what damage was done to the muscles by the segmental issue. So there is definitely there are definitely situations where the segment is fine, but there's a lot of dysfunction still. You'll see that after knee replacements. You know, they can replace a whole joint, but that didn't make your quads go back to a normal length. They didn't make your gracilis and your semitendinosus and your sartorius suddenly go back to being flexible after they had to separate the pes anserine tendon from the bone and then replace the whole joint and then put the tendon back to heal. That's some trauma to those muscles. They're going to be short. So there's only so much that rehabilitation can do for shortened muscles. And inhibited muscles, by the way, don't necessarily wake up either just because you're focusing. Electric stimulation on motor points of those muscles is what's going to wake them up and just basically correct the inhibition. And of course, the electric stim on motor points of a tight, short, hypertonic muscle can do a lot to restore the blood circulation, flexibility, elasticity, contractility of those quad muscles. So that's how we get fast results. We're correcting the muscle imbalances that lead to the joint pain, and no needles go into the knee when I'm treating. I don't do that. It's excessive, and it doesn't even make sense to me. If you think somebody has pain in the knee, how are my needles going into the knee? Unless I could do an injectate, there's nothing logical to me about putting needles into an inflamed joint. And yes, electric stimulation can neuromodulate pain, but the pain in the joint, as I said, is coming from dysfunction. It's not actually coming from the knee joint. So you fix the dysfunction so that there's no more rubbing, there's no more fraying of tendons, and you get blood circulation back, and then there's no more pain. So okay, well, I ran a little long. I try to kind of keep my podcast episodes under 20 minutes so that it's not too long, but you can listen to it in 1.5 times the speed or 2 times the speed if you want. Anyway, I thought it was important because I see what other classes are teaching. Every once in a while, I'm looking to see what are they teaching, how much are they charging, and things like that. Now, man, they charge a lot, don't they? I don't charge that much. I've been told that I undercharge and overdeliver. I keep it that way because it's so important to me that people learn this approach. It's way more important to me than that I make a ton of money. I hope that one day what I have contributed will be more important than how much money I made. So I don't charge a ton. And by the way, we still have seats open in Amsterdam in June. So, I'll put the link in the description. You definitely should consider it if you are already trained as an acupuncturist or medical doctor who has acupuncture in your license. You should consider coming to Amsterdam. It's going to be a great 3 days. And okay, I guess that's it. I will talk to you soon.